Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
I have had difficulty with dentists in the past as a child. I was terrified. I had a lot of bad experiences. And when I moved to Brighton a long time ago, I'd given up a very good dentist in London, and I stopped attending the dentist. And the longer that it went on, the more nervous I became, and I think it was about 12 years until I finally plucked up the courage to come to the dentist, and I was absolutely terrified. The first thing that happened to me was that I had the hygienist, I think, and I was very scared. It was the first time that anybody looked in my mouth for 12 years. I was terrified of that, but it was actually fine.
Question 26. Now read the question.
Okay, we're just going to numb you up here and we'll get started. Sharon, can you adjust that light a little, please? I can't see very well.
The bulb is out. I'll go look for one. I think Andrew is gone. Maybe I can find one. Sorry, Dr. Mitchell. Andrew is gone for the day and I can't find any bulbs. I'm really concerned about the light. I'll go get the loops with the light.
Never mind, Sharon. This is a pretty straightforward job, and poor Kate has been waiting a long time. You should be numb now, Kate, so we'll go ahead and get started and get you out of here, okay?
Dr. Mitchell, I'm concerned. I would feel more comfortable if we had better light.
You're right, Sharon. It'll only take a few minutes. Why don't you go ahead and get the loops for the light?
Thanks.
Well, I hope you had our first good day, Sharon. It was busy, but I think we worked well as a team. And thanks for speaking up about the light. You were right. We probably ended up finishing faster, and it was certainly safer with better light.
Thanks, Dr. Mitchell.
Well, we'll see you tomorrow.
Okay.
Question 27. Now read the question.
So one of the first things that we did was we ordered some labs. We had you give us some blood so that we could look at that. And the purpose of the lab tests was to make sure that you didn't have any vitamin deficiencies or other problems that could explain some of the memory difficulties that you had. But your labs came back completely normal. No problems there. Okay? The next thing that we did is we took some pictures of your brain. We did some neuroimaging. You remember doing that? Yeah, the big machine. And so we got a lot of pictures of the tissue in your brain, and the purpose of that is to make sure that you didn't have any strokes or other problems that could be the reason for why you've been having a little bit of difficulty with forgetfulness. But the brain scan was also essentially normal. There was a little bit of shrinkage, but not much more than would be expected for somebody of your age. Okay, and we didn't see any strokes or any other obvious problems there.
Question 28. Now read the question.
What level is your pain right now? From 0 to 10, 0 being no pain, and 10 being the worst pain you ever had, what number would you give it?
It's like an 11.
Okay. I'm sorry your pain's that high. Let me call the doctor, and we'll see if he can write you for something new, or if we can get your pain medication maybe a little bit earlier if he's comfortable with that. But I'll make sure he knows that your pain is very high right now at 11.
Yes, that does help me a little, knowing that the doctor's could possibly give me something different. My husband just left, and I'm here all by myself. And I'm really, on top of being in a lot of pain, I'm scared, I'm uncomfortable, and I really need to feel better.
This is your first time in hospital?
Yes.
Yeah, that does make sense. That's a lot of new things for you, huh? Okay. Is there anyone you'd like to call, or me to call? Is there maybe a phone I can get for you?
I'm okay right now. I think I'm in too much pain to talk on the phone.
Okay, let me go talk to the doctor about that and see if there's anything he can do. I'll make sure he knows about your pain. And then after that, because you don't have any family here, I'm going to make sure that I come in at least every hour, if not more, to check on you and see if there's anything I can get for you and make sure you have everything you need here.
Okay. Thank
Okay.
you. That does help. Thank you.
Okay. Let me put your head down a little bit, okay? See if that makes you more comfortable. You let me know.
Okay. That's good right there.
Okay?
Yeah,
All right.
that
Let me go
does
speak
help.
with the doctor. I'll come back and let you know what he says, and then we'll go from there.
Okay.
Okay?
All right. Thank you.
You're welcome.
Question 29. Now read the question.
I prefer to use a lot of visual aids, show children proper brushing technique, and explain to them the causes of sugar in terms they can understand. This is an especially important topic to me. What I find is many adults are fearful of dental treatment, and the adults that are, usually this stems from a poor childhood dental experience. So if we can keep the kids happy and healthy and comfortable at the dental office, this will lead to happy, healthy adults and adults that are less fearful of dental work. A good way to explain removing sugar, and I call them sugar bugs to the kids from teeth, is explain good hygiene habits and how to brush properly, the way to brush, and the type of toothbrush to use. And I tend to make this kind of fun for the kids. We like to explain that drinks and sugary foods can cause sugar bugs in the kids' mouths. And what the kids want to do is brush away all of the sugar bugs. We want to take a toothbrush and want to teach the kids how to hold the toothbrush properly, and that's a 45-degree angle towards the gums, and we want to just do small, gentle circles. And while kids do have to learn this dexterity, it's very helpful to tell them not to mash and push really hard. We just need to glide gently over the gums and gently brush back and forth. And rather than 45-degree angle, if we just tell them tilt the toothbrush a little bit towards the gums. Another good point is to tell them don't forget to brush your tongue, because a lot of sugar bugs hide on your tongue as well. So it gets the kids in the habit of brushing their tongue.
Question 30. Now read the question.
Hello, my name's Anne Trail and I'm the nurse consultant for infection control here at Ashford and St Peter's. Today at Team Brief, I talked about influenza. I talked about the impact that influenza can have on patients and on our staff. And the key messages from my presentation were around staff vaccination for influenza, to try and encourage our staff to go along to occupational health and to access the vaccination to protect themselves and to protect our patients. So a clear action that came from today's presentation and discussions afterwards was the implementation across the organisation of having peer vaccination, where we can train key individuals to vaccinate their peers within their working environment to help make the vaccine more accessible to our staff. So details of this will be on the Trust Net. Thank you.
That is the end of Part B. Now look at Part C.